come in and ask why we use Botox for migraines. People say, isn't that for cosmetic and pretty faces? Well, Botox has been approved for migraines by the FDA since I believe 2010 or 2011. Botox is indeed, it's the same stuff that they use for taking care of wrinkles. It acts as a mild paralytic. It actually weakens muscle and loosens up tight muscle, so it gets rid of wrinkles. What they found though, back in the 80s and 90s was that some plastic surgeons or people would go to cosmetic spas would get Botox injections for cosmetic purposes, and many people who had chronic headaches would just marvel at how much better their headaches got. So what they found was that Botox additionally seems to block the neurotransmitters, those messengers, chemical messengers that transfer to your brain that get the migraine started. Migraine headaches, for those who have them, probably pretty much know this, are a case where things occurring in the environment, like bright lights or loud noises or stress or multitasking, can affect your central nervous system, your brain and your spinal cord, and cause a chemical change that often will cause a big dilation of your blood vessels. It will cause a pounding headache and sometimes weird symptoms like numbness of the face or an halo around the eye. Botox tends to block that, and it tends to be very, very effective at doing so. Common question is, am I a good candidate for Botox? Well, that's a very good question to ask because there are criteria that people do have to meet in order to qualify for being a patient for Botox. Simply put, if you have had 15 or more migraine headache days per month, or put another way, if you were not on your medication, if you would have at least 15 or more migraine headache days per month, lasting at least 4 hours for at least 6 months, you may be a candidate. The second set of criteria involves medications. Essentially, there are 3 categories of medication that we use that are often used for Botox. One are antihypertensive or blood pressure medications. A second are what are called antidepressant medications, because not all antidepressants are used for depression, they're used for other things like headache treatment. And the third are what are called anti-seizure medications. And again, many seizure medications are very effective at treating migraines. For most insurances, if you have tried at least 2 of these 3 and found that they were not successful, or the side effects were too much for you, or for some reason they did not work one reason or another, in addition to the criteria I mentioned before, then in the vast majority of cases, you're a candidate for Botox. The Botox procedure is a very simple one. The patient simply lays back, and if you're the patient, we'll simply get you down and comfortable, sitting back in a chair, a comfortable chair. We'll take an alcohol swab and just swab over the areas on your skin, and it's done by a series of injections. Now, the injections are done with a very, very small needle. It's a 30 gauge needle, which is the smallest needle we have. If you think fiber optic cable, that's about not quite even a ½ inch long. It's a very thin needle, so it has very little feeling when it penetrates the skin, and the injections are just underneath the skin. So it's a tiny little prick, and you put a small bleb of Botox over a couple different migraine points. A couple on the forehead, a couple on the front of the face, a couple on the temples, and a few on the back of the skull and kind of in the upper back. The procedure takes as little as 3 to 4 minutes. It's very quick, it is minimal discomfort, and there are not many restrictions afterwards either. If you'll please take a minute to watch the following procedure that explains how Botox is done, we'll be right back. And first spot, it's just going to be right between the eyes. Again, these are very superficial. Okay, you all set? Mm-hmm. Okay, very, very gently. Do a little poke, 1, 2, 3, and pinch right there. That's 1. That's about as deep as you have to go. A little poke, 1, 2, 3, and pinch. 1, 2, 3, pinch. Good. So, procerus and corrugator muscles. It's going to be a little harder to frown, but makes a nice smooth forehead. That's a nice side effect. Could I have you open your eyes for just a moment? I'm just going to follow your pupil out here. And can you go like this for me? Okay, and just relax them. This is the frontalis muscle. We'll do a spot basically right here. 1, 2, 3, just a little pinch. I'm only doing 5 units of Botox at each site. It's a total of about 155 units. To give you an example, if you're doing like Botox for like a stroke patient or someone who had spasticity or tight muscles from a spinal cord injury or stroke, you might use 300 to 400 units, and you might do as much as 75 or 100 units in one muscle. So it's really not a lot of Botox in any one spot. So the chance of a side effect is very limited, minimal really. All right, if you wouldn't mind, I'll have you turn your head that way, please. Thank you. What I'm going to try to do here is we're going to hit this muscle here. It's called the temporalis muscle. So my first spot's going to be roughly a little pinch, little pinch, little pinch, and we'll switch off, reload. Thank you very much. Little pinch. Okay, and have you turn and face the other way? Good. I'm going to switch around here. So it's pretty symmetrical. What you do on one side, you do on the other. Total of 31 locations you're doing this, but as you can see, they go very quickly. 1, 2, 3, 4. Okay. That's the front and sides, and the rest of these are in the back. We're aiming for a muscle here called the occipitalis. The occipitalis is way under there. Very good with guys, very easy to do in guys with crew cuts. Longer hair, a little more difficult. Basically, we're going to get right about there. Just going to kind of go down just below to the hairline, digging the way through. That is some thick hair. Mm-hmm. Just going to pinch right in there. 1. Kind of basically an inverse triangle over here. We'll come to the other side. I'm just finding basically my muscle. There's just a little technique in how you find the point you're looking for. Roughly right about there. Base of the triangle. Thanks. One more right there. Okay. And have you lean forward just a little bit if you could. Thank you. These are the cervical paraspinal. These are the muscles that just kind of hold you up. I do about a finger breath here out from the center. A finger breath down from that. Same thing on the other side. Finger breath out from the center. Finger breath down from that. Okay. Last 3 spots we'll get on each side. This muscle's right here. So most people, you don't have to disrobe or anything. You just kind of pull their shirts back a little bit. You kind of clean along what we call the necklace line. If you're wearing a necklace, you look at where it would fall. So you figure roughly right there. That's one spot. Do a little pinch. And then kind of halfway between the center line and there, so about there. And then about halfway between there and there, so roughly there. Okay, that's that one. We'll switch sides here. And we'll switch over that way. So the necklace line, figure necklace would fall probably right about there. Oh, thank you. Yeah, a little cleaning first. Little pinch. Thank you. Pinch. And a little pinch. And that's it. Well, I hope you enjoyed that little clip. That's basically a demonstration of how Botox is done. As you can see, it's very quick, it's very well tolerated, and you're typically in and out. You don't really have to do any special preparation for it. You simply come in. For women who are wearing makeup, you can put your makeup right back on afterwards. Afterwards, all we basically ask are some very simple things. One is you don't lay down and you don't rub your face very vigorously for the next 4 hours because we want the medication to stay where it is. We don't want it to spread because, as we mentioned, Botox can weaken muscles. So a medication that's here, for example, on your forehead, we don't want it to rub down and make the eye look droopy. We ask you to avoid excessive heat for the next 2 to 3 days. So if you like to run in the wonderful South Carolina weather in the summertime, probably hold off for a little while. Beyond that, there are no other restrictions. You can take your normal medications, including any pain medications you normally have. In terms of success for Botox, what we're really looking for is, how many headache days per month are you getting with it as compared to before it. The vast majority of people, and in my experience, all but 2 patients that I can think of in my personal career, have noticed astounding effects. It works incredibly well, typically, for migraine. The most common thing you will see is that the number of headache days typically tends to diminish, and usually they diminish dramatically. Often patients who have 17, 18 headache days per month will come back and say, I had 4 this time. The second thing that is not quite as common but still happens frequently is the severity of the headaches over time tends to go down. So migraine patients will have fewer headaches. They will often tend to have much less severity. Now, you'll do Botox up to every 3 months, and there's a reason we wait for that. It's about a 12-week mark. Botox, as you know, is a toxin. It's in the soil. It's a natural toxin that we've harnessed for a better good. However, like any other foreign substance, your body's immune system can create antibodies against it. So giving to someone too soon is like immunizing a child against measles or smallpox. If you give it to it too often, your immune system will develop a perfect antibody against it and it'll never work again. So essentially, we want the body to forget all about it. So once you've taken it, we'll typically talk in a few weeks and see how you're feeling, and we will follow up at about the 12-week mark roughly, and if you want to have it done again, we certainly can.